The situation in the state of Goa due to the coronavirus outbreak is very, very serious. After facing flack from the opposition over deaths that have been reported due to an oxygen crisis, the Goa government, which was silent right up till now, has finally spoken out. Goa Health Minister Vishwajit Rane has said that 350 patients have been shifted from the old GMC building to the new super specialty block. The old building is where all the COVID patients have been admitted and wherein every single night there were deaths that were being reported, all of it a result of neglect and apathy. In a tweet, Vishwajit Rane assured people that the super specialty block will be commissioned at the earliest and a 20,000-litre oxygen tank will also be commissioned. He said that it will happen today. This as a full-blown political war has broken out over the COVID deaths in Goa. The opposition, which is the Goa Forward Party, has attacked the Chief Minister for failing to stop these fatalities due to an oxygen crisis, even alleging a rift between the Chief Minister and the Health Minister.
The problem is with the infrastructure there. The pipelines are very old, and if I am suppose that Health Minister also was record earlier saying that the maintenance needs to be done. The maintenance is taken care by the GSIDC, which is Goa State Infrastructural Development Corporation, which is headed again by the Chief Minister. I don't know what is GSIDC doing. They are saying that the pressure cannot reach on the third and fourth floor. Today morning I was coming from Ponda. I could see that, like a bullock cart, slow pace the trolleys were going in a tractor to the factory probably under a police escort. So if this is the situation and things are going on, I don't know, God only can save Goa.
Let me take this across now to Saurabh Bhaktania, who's been getting us reports from the ground on the plight of patients there at the Goa Medical College. Saurabh, a lot of promises that have finally been made by the government. They've woken up after all of these incidents of deaths were reported every single day at this medical college. They've also made several promises saying that all arrangements will be done by today. Has that actually happened on the ground?
No, not at all. Not at all.
Okay.
Nothing has been done yet on the ground. Today also, when India Today reached at this spot, there were still lot of tractors continuously coming in with trolleys and oxygen cylinders loaded. Now, let me tell you, Akshita, that this particular refilling of oxygen actually happens 15 kilometers away from GMC, which is in Kollim. There, this oxygen cylinders are actually loaded, and then through tractors and police protection, they are bringing it to the GMC. Now, at every single day, so many ferry of rounds continuously go on, but they don't have a proper infrastructure. They don't have a proper oxygen tanker that once can bring this oxygen to the GMC. They have to go around so many times through this Kollim and GMC. Now, the oxygen pipes which supply oxygen to the COVID wards, they too are very old. And therefore, there is oxygen fluctuation several times every day wherein people are dying. Now, Goa's Chief Minister has promised that within few days, by the time tomorrow or day after, this is done on a war footing. They are putting up a huge oxygen tanker inside the GMC premises itself.
Yes.
And thus, it can save life. But this has been done too little, too late. This could have been done much earlier. They were not prepared for the second wave, and even after the health infrastructure crumbled after the second wave, the officials took it long time to actually wake up.
It took a whole lot of outrage for the government clearly to wake up there in Goa, Saurabh, and even now they haven't done enough to protect the lives of so many patients who are struggling currently at the Goa Medical College. We're going to keep coming across to you, Saurabh, to get a sense of what's happening on the ground, whether the government is actually following up on their promises of providing adequate oxygen. They've said that they've shifted a lot of the patients, but it's clear here that the Goa government initially was in complete denial of there being a crisis at all at the Goa Medical College, saying that there was no problem whatsoever, all facilities have been provided. It's only after these deaths that have been reported in the last many days that we're finally seeing the government at least acknowledging that there is a problem. Saurabh, when you talk about how things haven't been done, there is a lot of politics also that's playing out, and the opposition has latched onto this, saying that the government simply isn't doing enough. Has the Health Minister personally taken stock right now of the situation? Has the Chief Minister responded?
No, Akshita, not at all. Again, in this particular situation, let me tell you, after so many reports put up by India Today, finally, over 350 patients from GMC are being transferred to super specialty block. Now, this particular block is a big question because it is still not commissioned. Now, Health Minister of Goa is appealing to the Chief Minister of Goa on Twitter to immediately commission this particular super specialty block. Why it was not commissioned earlier, and before commissioning the patients are already transferred? Why Health Minister and CM, there is no coordination can be seen. Opposition is also alleging whole thing that why there is no coordination between the CM and the Health Minister. Why actually they are not coming on ground and seeing what actually should be done at a war footing level. So this is the current situation in the state of Goa, and not just this GMC, the situation remains same at different places in Goa. People are actually fearing for life.
It's so unfortunate that the government simply isn't doing enough to address this crisis, and it's costing lives by the day in Goa. We'll continue reporting on this story and ensuring that there is accountability at the end of the day. Saurabh, thank you very much for joining us. There's big breaking news that's coming in now.